Pityriasis versicolor is a prevalent skin condition. It is characterized by patches of skin discoloration. These patches can be lighter or darker than the surrounding skin. This condition stems from a type of yeast that naturally occurs on the skin. Under certain circumstances, it can proliferate excessively, leading to noticeable changes in skin pigmentation. This comprehensive clinical masterclass is designed for dermatologists. It offers a thorough exploration of Pityriasis Versicolor, from fundamental understandings to practical clinical approaches. Whether you're a seasoned dermatologist or a resident, this resource aims to provide valuable insights into diagnosing, managing, and treating Pityriasis Versicolor. The masterclass will delve into the complexities of this common skin condition. Pityriasis versicolor is a truly global skin condition. It affects individuals across all continents and ethnicities, with considerable variation depending on geographical location and climate. Studies show it is more common in tropical and subtropical regions due to warm, humid conditions favoring yeast growth. The prevalence in temperate regions is generally lower. This highlights the significant influence of environmental factors on the development of this fungal skin condition. The prevalence of Pityriasis versicolor is strongly linked to climate and geographical factors. Warm, humid environments provide ideal conditions for the overgrowth of Malassezia yeasts. These yeasts thrive in the presence of heat and moisture, making individuals in tropical and subtropical regions particularly susceptible. Research in tropical countries reports prevalence rates from 40 to 60%, much higher than the 2 to 5% in temperate climates. This stark contrast underscores the profound impact of environmental factors. Seasonal variations also play a role, with higher incidence during summer months. Increased sweating and sebum production during warmer periods create a favorable environment for yeast proliferation. Understanding these factors is crucial for managing the condition effectively. Section 3. Demographics and predisposing factors. While Pityriasis versicolor can affect individuals of all ages, certain demographics exhibit higher susceptibility. Adolescents and young adults are particularly prone due to increased sebaceous gland activity during puberty. People with a family history of the condition are more likely to develop it, suggesting a potential genetic component. Individuals with weakened immune systems, such as those with HIV/AIDS or undergoing immunosuppressive therapy, are also at increased risk. Excessive sweating, often associated with physical activity or living in hot, humid climates, creates a moist environment conducive to yeast growth. Wearing tight, occlusive clothing can trap sweat and sebum against the skin, promoting fungal overgrowth. Understanding these risk factors is crucial for dermatologists. This knowledge helps in identifying and managing patients more effectively. Tailoring treatment plans based on individual risk factors can improve outcomes. Section 1. The culprit, Malassezia yeasts. Pityriasis versicolor is primarily attributed to yeasts belonging to the genus Malassezia. These fungi are natural inhabitants of the skin's microbiome, residing harmoniously without causing harm. However, under specific conditions, they can shift from their typical yeast form to a more invasive mycelial form. Their affinity for lipids, particularly fatty acids found in sebum, explains their predilection for areas with higher concentrations of sebaceous glands. Section 2. From commensal to pathogen, factors triggering overgrowth. The transition of Malassezia yeasts from harmless commensals to opportunistic pathogens is influenced by various factors. Warm, humid environments create an ideal breeding ground for these yeasts, allowing them to proliferate rapidly. Excessive sweating, whether due to physical exertion, hot weather, or underlying medical conditions, provides additional moisture and nutrients for fungal growth. Disruption of the skin's natural defenses can tip the scales in favor of Malassezia overgrowth. Section 3. The science behind skin discoloration. The hallmark of Pityriasis versicolor, the distinctive skin discoloration, arises from the interplay between overgrowing Malassezia yeasts and the skin's natural pigmentation process. As these yeasts proliferate, they produce metabolic byproducts that interfere with melanin production. Azelaic acid, produced by Malassezia yeasts, inhibits tyrosinase, a crucial enzyme in melanin synthesis, leading to hypopigmentation. This effect is particularly noticeable in individuals with darker skin tones. Section 1. A visual tapestry of Pityriasis Versicolor. Pityriasis versicolor typically presents with a distinctive visual pattern on the skin. The hallmark of this condition is the appearance of well-demarcated macules and patches. These lesions represent areas of altered skin pigmentation and often have a fine powdery scale. The color of the lesions can vary considerably, contributing to the name versicolor, meaning of several colors. In fair-skinned individuals, the patches may appear hypopigmented, presenting as lighter patches compared to the surrounding skin. In contrast, individuals with darker skin tones may exhibit hyperpigmented patches, appearing as darker brown lesions. This variability in presentation is a key diagnostic clue. Section 2. Beyond appearance, the patient experience. While Pityriasis versicolor is generally considered a benign condition, its impact extends beyond the purely cosmetic. The appearance of skin lesions can cause significant emotional distress and negatively affect the quality of life for many individuals. Patients often report feelings of self-consciousness and embarrassment, leading to social anxiety and avoidance of social situations. Section 3. A spectrum of presentations, variations on a theme. While the classic presentation involves hypopigmented or hyperpigmented macules and patches with fine scaling, Pityriasis versicolor can exhibit a spectrum of clinical presentations. In some cases, the scaling may be minimal or absent, making it difficult to differentiate from other pigmentary disorders. A thorough history and diagnostic tests like Wood's lamp examination and KOH preparation are crucial for accurate diagnosis. Section 1. Clinical examination, the first piece of the puzzle. Diagnosing Pityriasis versicolor begins with a comprehensive clinical examination. This initial assessment lays the foundation for understanding the patient's condition and guiding further diagnostic procedures. The dermatologist's keen eye and careful attention to detail are crucial for accurate identification and differentiation from other skin disorders. Section 2. Shining a light on the diagnosis, Wood's lamp examination. Following the initial clinical examination, Wood's lamp examination often serves as a valuable adjunct diagnostic tool. This non-invasive technique utilizes a specialized ultraviolet light source to illuminate the skin and enhance the visualization of certain dermatological conditions. Lesions of Pityriasis versicolor often exhibit a characteristic fluorescence under Wood's lamp. Section 3. Microscopic confirmation, KOH preparation, and beyond. The gold standard for definitively diagnosing Pityriasis versicolor remains the potassium hydroxide or KOH preparation. This technique allows for direct microscopic visualization of the fungal elements responsible for the infection. Performing a KOH preparation involves obtaining a skin scraping from the affected area and adding a drop of KOH solution. The KOH solution dissolves keratin, making the fungal elements more visible under the microscope. Section 1. Topical therapies, first-line arsenal. Topical antifungal agents are the cornerstone of treatment for Pityriasis versicolor. These medications work by directly targeting the overgrowing Malassezia yeasts on the skin's surface. Selenium sulfide is a highly effective antifungal agent commonly employed in the treatment. It is typically applied to affected areas and left on for 10 to 15 minutes before rinsing off. For optimal results, daily application for 1 to 2 weeks is often recommended. Section 2. Targeting widespread infections, systemic antifungal agents. More extensive or recalcitrant infections may necessitate the use of systemic antifungal agents. These medications are administered orally and work by reaching therapeutic concentrations in the skin. Fluconazole, a triazole antifungal agent, is a common choice for systemic treatment. It is typically administered as a single 300 mg dose, repeated weekly for 2 to 4 weeks. Section 3. Navigating treatment choices. Factors to consider. Selecting the most appropriate treatment regimen involves considering the extent and severity of the infection, patient-specific factors, and potential side effects. For localized lesions, topical therapies are generally the preferred first-line approach. The choice among agents may be guided by patient preference, cost considerations, and availability. Section 4. Practical guidance, optimizing treatment outcomes. Providing patients with clear instructions on medication application, potential side effects, and preventive measures is essential for optimizing treatment outcomes. Emphasize the importance of applying the medication to all affected areas and the proper duration of treatment. Section 1. Preventing recurrences, staying one step ahead. Pityriasis versicolor is notorious for its tendency to recur. Implementing strategies to prevent recurrences is crucial for long-term management. One approach involves the use of intermittent prophylactic antifungal therapy. Topical antifungal agents such as Selenium Sulfide or Ketoconazole Shampoo are often employed for this purpose. Section 2. Lifestyle modifications. Cultivating a yeast-unfriendly environment. Lifestyle modifications can significantly contribute to preventing recurrences. Managing excessive sweating is one of the most effective modifications. Patients should wear breathable clothing made of natural fibers and choose loose-fitting garments. Regular showering, particularly after physical activity, is paramount for removing sweat and sebum. These measures help create an environment less hospitable to Malassezia yeast growth. Section 1. Pediatric considerations, gentle approaches for young skin. Pityriasis versicolor can affect children, albeit less frequently. When managing this condition in pediatric patients, it's crucial to adopt a gentle approach. Topical antifungal therapies remain the mainstay of treatment, starting with a lower concentration of selenium sulfide and gradually increasing as tolerated is recommended. Section 2. Pregnancy and breastfeeding, weighing risks and benefits. Managing pityriasis versicolor during pregnancy and breastfeeding requires a delicate balance. Topical therapies are generally considered safe, as they are minimally absorbed into the systemic circulation. Selenium sulfide should be used with caution, especially during the first trimester. Section 1. Integrating knowledge, optimizing outcomes. Pityriasis versicolor, while a common and generally benign skin condition, presents a unique set of challenges for both patients and clinicians. Its propensity for recurrence, coupled with the potential for cosmetic concerns and psychosocial impact, underscores the importance of a comprehensive and individualized approach to management. By integrating the knowledge gained from this masterclass, dermatologists can enhance their diagnostic acumen, optimize treatment strategies, and empower patients to effectively manage their condition. The diagnosis of pityriasis versicolor hinges on a thorough clinical examination, often aided by Wood's lamp examination and confirmed by KOH preparation. Recognizing the diverse presentations of this condition, including variations in color, scaling, and distribution, is crucial for accurate identification and differentiation from other skin disorders. Once diagnosed, a range of effective treatment options are available, encompassing both topical and systemic antifungal agents. Topical therapies such as selenium sulfide, azole antifungals, and cyclopyroxolamine are generally preferred as first-line treatment for localized or limited cases. Systemic antifungal agents, including fluconazole and itraconazole, are reserved for more extensive or recalcitrant infections, or when topical therapy is impractical or not well tolerated. Selecting the most appropriate treatment regimen involves careful consideration of factors such as the extent and severity of the infection, patient-specific factors, potential side effects, and patient preferences. Beyond medication management, patient education and counseling are paramount. Providing clear explanations about the nature of the condition, its tendency for recurrence, and the importance of adherence to treatment recommendations can alleviate anxiety, enhance compliance, and improve long-term outcomes. Additionally, advising patients on lifestyle modifications, such as managing excessive sweating, wearing breathable clothing, and practicing good hygiene, can significantly reduce the risk of recurrences. By embracing a holistic approach to the management of Pityriasis Versicolor, dermatologists can provide compassionate, patient-centered care that addresses both the physical and psychosocial aspects of this common skin condition.